U.S. officials issuing a travel advisory this week following concerns surrounding the Zika virus. This is a new disease that is spread by Latin American mosquitoes and can lead to birth defects in newborns. So far, individuals in Texas, Hawaii, Illinois, and Florida have contracted the disease, and so far, there is no treatment. Let's bring in NYU School of Medicine Clinical Associate Professor Dr. Devi Nampiaparampil.
Oh, perfect.
Yeah, I don't know how you ever use your last name. I'm like, I know how to pronounce Devi's last name. Devi, if you read about this, it's frightening.
It is.
And should we be frightened by it?
I don't think we need to be frightened in this country unless we're traveling to the affected countries. It's spread by mosquitoes, so you can't spread it other ways between people. So for the most part, we are safe. But if you are traveling to those countries, then you have to be concerned if you're a woman who's reproductive age. I mean, just for reference, in Brazil, almost 4,000 babies have been affected by these birth defects. And in Colombia, the government itself is actually saying that women should delay having a pregnancy if they can.
Why wouldn't this be a disease, though, that winds up here in the United States?
Well, those mosquitoes are very specific to those areas, so in theory they could come here maybe in the spring or summer. I mean, right now it's the winter, so we're not really as afraid of mosquitoes. And then on top of that, you know, it depends on the weather patterns and whether mosquitoes would actually be able to gain a foothold here. I mean, the bigger concern is for people who are traveling to those countries. I mean, the issue is what you mentioned, that we don't have a treatment, we don't have a vaccine. And so if a woman were to actually spread the virus, Zika virus, to the baby, then you would be worried about birth defects like the brain being small, the head being small, and perhaps a miscarriage.
What about the timing of this, right? Is it if you're exposed and you're of child reproductive age and then you get pregnant later, you still can have those birth defects materialize?
No, not necessarily.
Only during pregnancy.
Exactly, during pregnancy. And usually earlier in the pregnancy is where it's more of an issue because that's when the brain and the baby is developing, so it can be an issue then. And in terms of the testing, of course, you know, right now you could keep testing, but if you don't have a treatment, then it's difficult to do anything.
Dr. Devi, always great to see you. Take care, Dr. Devi.